Irene stayed home and raised our children. After they left for college, we started planning all the wonderful things we would do after I retired. We were going to travel. There are so many places we wanted to see. After our first trip, I started noticing that Irene wasn't acting like herself. She wasn't as energetic. When we got home, she went to the doctor. They said there was nothing they could do for her. The cancer they found had already spread all over her body. She died 5 months later. Within the elderly population, risk factors of depression include death of a loved one, retiring, recovering from illness, and becoming ill. Other risk factors for depression in the older adult include experiencing chronic pain and living with chronic medical conditions, cognitive decline, and functional decline.
After my mom died, Dad wasn't the same, which wasn't surprising. He's so irritable all the time. He's also getting very forgetful. He used to be sharp as a tack. I'm worried he's developing Alzheimer's.
Depression in older adults may be hard to recognize. They often do not show the same sort of symptoms as younger adults and can be mistaken for other conditions, such as Alzheimer's. Signs and symptoms in older adults include fatigue, insomnia, irritability, confusion, and attention deficits. Chronic aches and pains, as well as digestive problems, can also be indicative of depression in the older adult.
I was starting to worry he was depressed.
Depression in later life has negative impacts on quality of life. Depression in the older adult can cause an increased morbidity and mortality and can exacerbate chronic medical conditions.
Providers often underdiagnose depression in the older adult. They see depression in the older adult as a normal reaction to the life changes that older adults encounter. 24% of all suicides in the United States are completed by the elderly. The greatest number of suicides occur in elderly men 85 years or older. A large portion of older adults that have successfully taken their own life are experiencing depression for the first time. Most of these suicide victims had also seen a doctor within the weeks leading up to their death. As providers, we can help.
Various scales, such as the PHQ-9 or geriatric depression scale, are quick and effective ways to screen for depression. Once diagnosed, most older adults can be treated successfully with antidepressants. Non-pharmacological approaches, such as psychotherapy and exercise, can also be utilized.
During my dad's physical, his provider screened him for depression. Dad was able to get the help he needed.
As providers, it is important for us to learn the signs and symptoms of depression in the older adult. By screening for depression in the older adult, we can help them to achieve a greater quality of life.